everyone, my name is Alexios. Today I will present our work on the role of school nurses in Greek education with a focus on health, safety and inclusion. The school nurse is more than a health professional. They are the bridge between education and care, ensuring that schools are safe and inclusive environments for all children. Students today face complex health and emotional challenges. School nurses provide daily care and emotional support, and they also work to promote safe and inclusive school environments. By reducing stigma and improving access to care, nurses help students feel both healthier and more accepted, which ultimately improves their learning outcomes. The presence of school nurses has a unique history. At first, their role was limited to special education settings. Over time, thanks to local initiatives, their presence gradually expanded into mainstream schools. However, this growth was uneven and lacked central policy support, which left many regions without proper coverage and without clear job descriptions. Even today, there are important institutional gaps. Greece still has no national policy or legal framework for school nursing. Many nurses work under temporary contracts, their possibilities vary across regions, and collaboration with teachers is often limited. This leads to professional isolation and confusion about their role. The pandemic highlighted the essential role of school nurses. They led health protocols in schools, supported emotional well-being during lockdowns, managed testing and quarantines, and reassured families and staff. COVID-19 made it clear that nurses are not optional. They are essential to school resilience. On a daily basis, school nurses handle chronic conditions like asthma or diabetes, administer medication, and educate staff on emergency protocols. They support hygiene and nutrition habits while also offering emotional stability to students who may feel overwhelmed or anxious. Their work goes far beyond medical care. It is about holistic support. School nurses also contribute directly to health education. They provide informal guidance on hygiene and nutrition, lead workshops on mental health or sexuality education, and use bulletin boards to share information. These activities build lifelong self-care habits and help reduce risky behavior among young people. Another vital role is prevention. Nurses coordinate vaccination programs, monitor for contagious illnesses, and conduct routine screening such as vision or hearing tests. This early detection is particularly important in underserved areas where access to regular health care might be limited. Teachers often observe behavioral changes in students, while nurses can interpret this as health-related signs. When both collaborate through joint planning, staff meetings, or inclusion in individualized education programs, student outcomes improve significantly. Collaboration builds stronger support system for children. Nurses also act as bridges to families. They build trust with parents, explain medical information clearly, and support migrant or vulnerable families who may struggle with the health system. By hosting parent workshops and mediating conflicts, they strengthen the link between schools and communities. Beyond physical health, nurses help students cope emotionally. They recognize signs of distress, provide safe spaces, and guide coping strategies. They also support teachers during crises, helping create emotionally safe learning environments where resilience can grow. School nurses foster emotional intelligence by modeling empathy and respect. They support students who feel different, reduce stigma, and encourage peer understanding. This helps build an inclusive school culture where diversity is seen as strength rather than difference. New challenge for schools is digital well-being. Nurses identify signs of screen fatigue and educate students on healthy device use. They collaborate on digital detox campaigns and support families with strategies for balanced screen time. Their role in promoting emotional balance in the digital era is increasingly important. Despite their importance, school nurses face ethical and legal challenges. There are no standardized guidelines, and confidentiality or consent issues often arise. Without proper reporting protocols, legal conflicts with families can occur. Clear ethical safeguards are urgently needed. Looking ahead, Greece needs a national strategy for school nursing. This includes stable funding, specialized training in child psychology, and integration of nurses into school planning. Above all, equity must be achieved so that students in all regions benefit equally from their presence. In conclusion, school nurses are essential, not optional. They support student health, inclusion, and resilience, and act as bridges between health and education systems. By shaping emotionally safe learning environments, they help children thrive academically and socially. As we often say, healthy children learn better and supported children truly thrive. Thank you for your attention.